Hello, everyone, and welcome. This is the first ever als.community webinar, and today's subject is something that's relevant to all, and that is with the sweeping tax changes that occurred this calendar year. How is that going to affect federal benefits for people with ALS? And I'm very grateful that we have three esteemed guests. The first of which is Chris Howell. He is the treasurer on our board at als.community. And our MO is that there's at least one patient on every panel to make sure that that perspective is shared. And then I'm also very grateful to have Christa Frank High, Esquire, and Jerry Rothkoff, Esquire, to join us in all of the legal issues that are central to the conversation. And so with that, I'm going to hand it over to Chris to talk about what these benefits mean to somebody with ALS.
Thank you, Jeff. I wanted to just mention, when I first was diagnosed with ALS, I worked as long as I could because you don't know, how long you've got left. And I wanted to have everything arranged financially for my family. But once I stopped working, that loss of income was really impactful. And the benefits that I started receiving from the government, Social Security, disability, Medicare, have really been a godsend for us. We need that kind of income and that kind of medical coverage in order really to survive. And without that kind of assistance, I don't know, what we would do. We really need it. We depend on it, and we use it each and every month. With this, I know that at the very least, our family has enough for groceries and electricity and the things that we need, for everybody to survive. I was the sole provider for my family. And it's tough when you can no longer provide. But this at least helps me feel like I'm still fulfilling that role. Yeah, I don't know what we would do without it. So, Jeff.
Okay, I just wanted to make sure that you said everything that you wanted to say, and thank you, Chris, because this is policy and law, but it's deeply impactful on people's lives. So thank you for sharing that. I'm going to hand it over to Christa Frank High, who is going to talk about Social Security disability and how that could be affected with the upcoming changes. And then she's going to pass it off to Jerry to talk about the law itself and what it does mean and what it could mean. So Christa, with that, please take it away.
All right, thank you, Jeff, and thank you for Chris for what you said. I'm going to start sharing my screen so you can see my PowerPoint. Okay. Everybody see that?
Yes.
Okay. So I'm with the law offices of Daniel Sigel. We're in Havertown, Pennsylvania, outside of Philadelphia. And we have a Social Security disability and supplemental security income practice. So helping folks get the benefits that they need. So I want to talk a little bit about just the basics of Social Security, how you get it, if you have ALS, and the medical requirements, and then talk how the new legislation is going to affect you. And then I'll turn it over to Jerry, who will talk a lot more in detail about the impact of legislation and regulations coming. So just to start, so Social Security and supplemental security income, I think we know the difference. SSD is what applies when you have paid into the work system. And so then your benefit depends on how much you've paid in. Then supplemental security income is where you're disabled, but you haven't necessarily worked long enough or paid enough into the system. And so as long as you can show financial need, then you can be eligible for benefits. So like I mentioned, basically for SSD to be eligible, as long as you've shown you're disabled, if you've disability started within 5 years of the date you last worked, then you should be eligible for SSD. SSD is the better one because it's not dependent on other resources or assets that you have. You get it if you've paid in. An SSI, of course, the general guideline is if you have less than about $2,000 to your name, then you can be eligible for supplemental security income. This is the basic statutory definition for how you can show you're disabled. Basically, you have to have a medical condition, physical or mental, that is expected to last 12 months. So SSD recipients are eligible for Medicare, and then SSI, it's typically Medicaid. So like folks with ALS who are eligible for Medicare are on SSD, and Medicaid is SSI, and you can get it right away. Now, the application process for ALS patients, so I'll just go through this briefly. So you can apply online or by phone, however is easiest for you, but you do have to provide medical information. So you get all the information from your doctors. Social Security will gather it as well, and they sometimes will do an interview. There is the 5-step process. You do need to show that you don't have substantial gainful activity, which is that you're not making more than about $1,600 per month. The thing with Social Security and ALS is that it is considered a compassionate allowance condition, which means you get expedited processing, which is very good because you don't have to go through the very long wait times. For typically in the Philadelphia area, it can be up to 2 years before folks go through the entire process because you file your initial application, then you file a request for reconsideration, then you ask for a hearing before the judge, and that's usually the best chance. But for ALS, you can skip that. There's no 5-month waiting period to get your benefits. And the claim can be processed quickly as long as you have the medical documentation they need. And that medical documentation is, you can find it in section 11.10, one of the listings, but you need to have neurological findings consistent with an ALS diagnosis. They like to see electrophysiological and neuroimaging testing, EMG testing, things like that, and a history and examination that's consistent with ALS. And once you have that, they're generally going to get you benefits quickly. So now the One Big Beautiful Bill Act and its impact. So I will go over a little bit here, and then I will turn it over to Jerry. So there's a senior bonus now that's in effect from 2025 to 2028. So if you're 65 or older and you're getting SSD, you can get an extra $6,000 tax deduction each year. But this does phase out, as I have here on the slide, if your income is high. If you're under 65 and on SSD, then the new deduction does not apply. But otherwise, your SSDI is still taxed the way it has been. If it's your only income, you might owe no tax. If you have other income, then you can see the thresholds here. The tax starts at 25,000, up to 85% is taxed above 34,000. And if you're married, then the tax starts at 32,000, and then up to 85% is taxed above 44. SSI benefits aren't taxed there. There are some new rules that there's a proposal right now that's still listed as pending that could affect folks who are getting SSI and how in-kind support and maintenance is calculated. If you're receiving SNAP right now, then you're exempt from if you're getting rent, or if you're not paying rent or your family is helping you, then that doesn't get calculated in your in-kind support and maintenance. But now it might, if this change goes into effect and you are receiving SNAP, then the deductions for food and shelter from family could change. So just have to be paying attention to that to see how that could affect you, and whether you need to be documenting more of your expenses. So that is a concern. The other thing is that it's helpful to have the increased deduction, but then the loss of revenue to Social Security can mean that the trust funds can run out sooner. So right now it's projected for late 2032, which is disturbing and soon. But so we have to make sure that the government is balancing out tax cuts so that there's revenue. So SSDI is funded through payroll taxes and is part of the broader Social Security Trust Fund. But SSI is funded by general tax revenues and not the trust fund. So it may not be impacted the same way if Social Security were to become insolvent. So this just means that SSDI could face benefit reductions if insolvency were to occur. SSI might be a little more stable, but it still could be vulnerable to federal budget cuts. So those are the basics of how, you get Social Security disability or SSI benefits. The application process, it should be quick for folks who have a diagnosis of ALS. You just need to have your medical documentation together, and then those are some of the taxes. But I will turn it over to Jerry to go into some more detail.
All right, well, thank you, Christa and Chris, for your words. And for those who are participating live, you are welcome to ask any questions. You probably know how to use the chat by now, so just want to mention, feel free to put any comments or thoughts into chat, because we'll most likely save some time for Q&A and to address any questions or concerns that you have. Before I get into my presentation, can I just, Christa, when you talk about Social Security disability, unfortunately, as we sit here today in this Zoom room, we have a government shutdown. So just throwing that out there. So how will does that have any effect on those who are now applying for Social Security disability as of this week? I mean, are you aware of? And how will that, any disruptions, especially if this shutdown goes on a longer term basis?
Yeah, I mean, folks should still get their benefits, but all disruptions can affect you. Even before the shutdown, we're having some issues getting a hold of people because the staffing is so reduced. But it is possible that it can affect you, but you should still be getting your checks. I mean, that should not change.
But for those who are now applying for Social Security disability,
I think it could take longer.
Okay.
Yeah.
All right. Well, thank you for that. Hopefully, by the time people are watching this presentation, it will be resolved. But I guess time will tell.
Let's hope.
So I'm going to go share my screen. So give me a minute. Am I good? Everyone with me?
Seems
It's up
to be.
and running?
Now it is,
Yes.
yes.
Okay. All right. I'm Jerry Rothkoff. I'm managing attorney of Rothkoff Law Group. Like Christa, I am also in the Philadelphia area. We have offices in Eastern Pennsylvania and South and Central Jersey, and we work with older adults and those with disabilities, and including individuals living with ALS. And Chris, I thank you for your very personal words and about the importance of the benefits to you and your family. So let me start out by talking about this quote. And before I even do that, as a preliminary, let me just state this, because I am biased. I am a card-carrying advocate for older adults and those living with disabilities. So I just want, as a full disclaimer, I am biased to advocacy for older adults and those living with disabilities. So any attempt to limit access to certain benefits, I get personally offended by. So I just want you, that's the lens I'm coming from. All right. So if you couldn't tell as we go along over the next 20 minutes or so. So let me start out by this quote. This quote was by Hubert Humphrey, who was a vice president of the United States, and then, of course, former governor, I believe, of the great state of Minnesota. So he stated, the moral test of government is how it treats those who are in the dawn of life, the children, those who are in the twilight of life, the elderly, and those who are in the shadows of life, the sick, the needy, and the handicapped. This was actually right before he died, I believe. This was his last public speech that he made. And I'm not going to answer the question, but I'm just going to raise the question. So if that is true, and you can disagree, certainly, then how are we doing? That's a rhetorical question, but we can come back to it if you like. But I'll leave it to you to see how we're doing. If that is what you believe the moral test of government, are we doing a good job of that? So let me just talk about the One Big Beautiful Bill. The One Big Beautiful Bill was very controversial. It was signed by President Trump, as many of you know, on July 4th, 2025. And I would argue that it has fundamental, maybe in the future, because many provisions will not go into effect until over the next few years, but it has fundamentally changed the philosophy of providing government healthcare benefits to United States citizens more than any other bill previously, I would argue. Now, what the ultimate shape of the bill would be is still open for debate, although it's law. And so, of course, the name of the bill is the One Big Beautiful Bill. So that's what we're calling it. It's not a political name. It's just the name of the bill at this point. So it's the law. So there's no way of getting around that. Of course, the government shutdown is over the bill, really. That's really, and you know, you can argue who's to blame all you want, but the government shutdown is over future healthcare benefits. That's really what it boils down to. And whether it's right or wrong, or you can blame who you want, feel free to do so. But that's what it's all about sitting here today as of 12:01 a.m. this morning. So what the future shape is still could be determined. I mean, there certainly still could be changes to this bill. So it's not gospel necessarily. But we're going to go over some of the important changes specifically related to Medicaid. Just a few things. Most of the provisions do not go into effect until January of 2027. There are, except for some of the tax provisions and except for some of the Obamacare expansion, those will change. And The bill mainly affects the individuals under the age of 65 population. And we'll talk more about it, certainly. The purpose of the bill and the mantra in Congress was the goal was to eliminate fraud, waste, and abuse. Fraud, waste, and abuse with government programs, specifically Medicaid. Now, again, I'll ask, like Hubert Humphrey's quote, I'll leave it up to you to determine whether you believe this, it does so. I would argue it doesn't. There were other ways to address it, but what it actually does in reality, and again, the Government Accounting Office, the GAO, which is a bipartisan government department that really looks at the numbers of bills and what it will cost, has determined that this will increase the deficit, not decrease the deficit. So does it eliminate fraud, waste, and abuse? That was the mantra. Is this the vehicle, this bill, to eliminate fraud, waste, and abuse? That's an open debate, and I guess only time will tell. Many of the tax provisions take effect beginning in 2025, like Christa mentioned, $6,000 exemption on Social Security. That will take an effect for Social Security beneficiaries as of January 1 of this year. So that will be a retroactive, and many of the tax provisions will be retroactive as well. Let's talk about what's in the bill. And one of the items in the bill, believe it, you may not be aware of this, actually has to do with nursing home care, which may surprise you. Under current law, there's actually no specific requirements under federal law for staffing in nursing homes. Many of our clients at some point during their lifetime do need nursing home care, unfortunately. And under federal law, there is no specific staffing requirements regarding quality of care in nursing homes. This current standard is kind of a gray area. They must, all licensed nursing home facilities that accept Medicare and Medicaid, which is pretty much 100% across the country, must provide nursing services and staff to attain and maintain the highest practical mental, psychosocial, and physical care of all residents. That's the basic requirements under federal law. But of course, what does that actually mean? Most states have federal state requirements, but there is no federal staffing requirements. So during the Biden administration actually passed through CMS, Centers for Medicare and Medicaid Services, federal staffing regulations. And they went into effect as of April 2024, after a 2-year debate. As a result of that, CMS implementing the regulations, the nursing home proponents, both for-profit nursing homes and nonprofit nursing homes, filed a lawsuit to bar the implementation of CMS regulations. As a result of the lawsuit, the Trump administration put in this bill specific provisions that bar the federal government from enforcing minimum staffing regulations for a period of 10 years from the date of the bill. So the ultimate result is that there is for the next decade, as of July 4th, 2025, there will not be any federally required minimum staffing regulations. And the whole push to improve the quality of nursing home care really stemmed from what happened in licensed nursing home facilities across the country after COVID. We saw the devastation that COVID wrought for many individuals, including those nursing home residents. So, but as a result of that, there would be no federal staffing requirements for 10 years. That's the law unless it's revised. So there was a second provision through CMS regulations that the Biden administration passed, and these were regarding transparency requirements. What I mean by transparency requirements is basically who actually owns each individual nursing home. Without going too deep into details, most nursing homes, specifically those that are privately owned, that are not nonprofits, that are for-profit facilities, have a tentacle of ownership. And the whole goal is basically risk management. They want to reduce liability. So they set up different tentacles and different webs so you really it's very difficult to determine who the actual owner is. So the Biden administration required facilities to state their specific ownership structures, as well as if any ownership is tied to private equity. They must lift the daily staffing levels and whether they use contract or temporary workers. Some of that may not seem very important to the average individual, but these disclosures are actually very important. So families can determine the quality of care for these facilities for their loved one for proper placement as is needed. So it's questionable whether these transparency requirements are going to remain in place, or will CMS now revise the Biden era CMS regulation. So that's an open debate. So whether they will remain in full force or not, but certainly the staffing regulations do not. ABLE accounts. Some of you possibly have heard of what ABLE is, and it's an acronym. An ABLE stands for Achieving a Better Life Experience. And there were some, if I can say anything positive about the One Big Beautiful Bill, this would be it. All right, so there you go. So what the ABLE account is, it allows individuals living with disabilities to set aside money in an ABLE account without losing eligibility for Medicaid or other means-tested public benefits. For example, SSI, as Christa mentioned, with the $2,000 limit, or Medicaid. This is an addition, and this is a totally separate topic that I'm not going to talk about today. This is an addition to setting up a first-party special needs trust for an individual under age 65. So you can use an ABLE account. However, ABLE accounts have limitations. Up until the end of this year, or till the end of this year, a disability must have occurred prior to age 26. So therefore, it's a sudden onset, or of course, it could be a developmental disability. As of January 1, 2026, that age will be increased to age 46. So it still may not encompass, of course, many people who have been diagnosed with ALS, but it certainly can include some of those who were diagnosed at ALS prior to turning age, with ALS, I should say, prior to age 46. And there's a maximum contribution of $19,000 per year. So again, there's limitations to the amount of assets, and there also there's other new provisions through ABLE accounts where you can roll over a 529 plan, which is a college savings plan, into an ABLE account. So you're going to see the ability to use ABLE accounts more widely than what you can currently as of the beginning of 2026, because of the 20-year increase in the age of eligibility. Let's talk about some of the Medicaid changes that will go into effect, and some of which is to be determined. Some of the key Medicaid changes would include what's called biannual redetermination. So if you are on Medicaid, currently each state, or at the county level, most typically, would be required to to determine eligibility on an annual basis. In other words, for a single individual, you can have no more than $2,000 in assets to qualify for Medicaid and SSI. Again, this is state specific, so to a certain extent. So if you're living in California, it may be different than Pennsylvania and New Jersey, where Christa and I work. So you have to determine each state, but I'm just using it as an example. The eligibility is determined annually. As of, this is going to affect in January of 2027, it's going to be redetermined every 6 months instead of annually. It doesn't sound like too much on its face, but it can be, I would argue it's going to be significant. Those biannual redeterminations apply to Medicaid expansion services. For example, it would not include those who are living in assisted living, home and community-based Medicaid services, or nursing home residents. It's what's called the Obama expansion population, or Obamacare population. So but that just creates more paperwork in reality. And there will be further delays and lapses. Why? Because the issue is, it's great for the federal government to issue these proclamations, pursue and make it law. I mean, you know, on its face, okay, what's the big deal? Well, the question is, who has to implement these changes and enforce these changes? It's actually each individual county in each and every state. So each county, for example, in New Jersey, there are 21 different counties. Pennsylvania, there's 60-something different counties. Each county has its own public assistance office, and you have to go through each county eligibility offices. And it falls on the county caseworkers. Well, as Christa and I can vouch for, they're already overworked and backed up. So when you're creating double or triple the amount of paperwork and work, how will these requirements, which are law, be enforced, and how will they be handled? It's just going to create further delays that I would argue in many cases are unnecessary. There's one of the big changes, and I'm sure this was very controversial, and I'm sure that you have read about it and heard about it, is work requirements for individuals age 50 and to age 50 and 64 years old. Currently, there are, and up to this point in time, if an individual is eligible for Medicaid, they are eligible for Medicaid, whether the financial eligibility or for fit or because of a disability or health insurance, there's no requirement to prove that you're unable to work or whether you're working or not. So individuals as of 50 to 64 will need to verify that at least 80 hours per month of work, unless they are an exempt. In other words, they could be exempt if they're 100% disabled. They could be exempt if they're in assisted living or nursing home. So the argument is 92% of non-disabled individuals under age 65 are already working, caring for a family member, or managing an illness or disability. So if you have ALS, you've been diagnosed as disabled, you in theory are exempt from that, from the work requirements. But how will that be actually implemented? And again, this must be enforced at the state level, specifically if you want to even drill down, it would be all enforced, as I mentioned, at the county level. So how will that be enforced there's no easy answer for that. And so one of the issues that we see is that, again, you have already overworked individuals who are required to process applications for anyone from at home to a nursing home and everywhere in between. And where are the hours for these caseworkers to process the paperwork? How are they going to determine whether an individual is able to work or not? I think we would all agree, and no one will argue against, if you are an able-bodied individual, before you receive any Medicaid benefits in any such way, if you are able to work, you should work. Every able-bodied United States citizen who is able to work should work and not rely on the public dime. I don't think we can argue against. I don't think anyone certainly can argue against that in principle. But in practice, it's not as simple as it sounds. How are you going to prove you're going to work? How are the caseworkers going to determine whether you work or not? Now, even if you have ALS, you still might be caught in the paperwork. Okay, well, what type of medical documentation do I need? You know, well, I didn't file something, therefore I was denied because I should be working. So, and it just creates further delays that I would argue do not necessarily need to exist. And if you want to go one step further, if you look at states that have attempted to implement work requirements for Medicaid recipients, it has failed miserably. Specifically, the states of Mississippi and the state of Georgia have tried this. And ultimately, all it did was increase the budget. In other words, they had to purchase software. The software in the state of Georgia cost over $30 million to implement. So it's not, again, on paper, it sounds okay. I don't think it makes sense, but the implementation is always going to be an issue. And I think it will negatively affect those with disabilities moving forward. Issue with nursing homes, shorter retroactive coverage period. Currently, this is in a nursing home setting, not in a home and community-based setting. If an individual enters a nursing home and you're eligible for Medicaid, you have 90-day retroactive period, because when you file an application for Medicaid, it's not approved the next day. So there's a 90-day retro that goes back, period. Which is good, because a lot of times when someone enters a nursing home, they enter from a hospital and they enter in what's called in a subacute setting. I have up to 100 days of Medicare coverage. And then, so they may not know they're going to stay there a long term, at that point in time. But in this particular case, benefits would be, and it can go back 90 days to retroactivity. Under the new law, it's a 30-day reduction in the retroactivity. It's a 60. It will be a 60-day instead of 90 days. So that could be a problem for the individual. And who else could be a problem for? And who wouldn't get paid? The nursing home industry. That's not good for nursing homes either, because they're going to be holding an empty bag, basically. This arguably will affect those living in a home and community setting with ALS. The question is how. The devil is in the details. Cuts to long-term care support. The federal government, the Medicaid is a joint federal and state program. The feds give the states money, and the states then determine how to use that money. There's a difference between home and community-based services and nursing home Medicaid services. In a nursing home setting, the states are required to provide all individuals full Medicaid benefits, 24/7 care in a nursing home setting. However, outside of a nursing home setting, including an assisted living or personal care setting, at home setting, that is not the case. So in a home and community-based setting, in other words, anything outside an institutional nursing home, it's called home and community-based services. Well, under the One Big Beautiful Bill, the feds are going to significantly decrease Medicaid funding to the states. And therefore, the states can then make changes which will be necessary to be made. This is effective in 2027, I believe, in January 2027. The states will need to balance their budget. They can't cut nursing home Medicaid services, but they can cut services for those in a home and community-based setting, including those with ALS. In other words, you have your you still have your Medicare coverage, but of course, for those who need 24/7 care, their insurance doesn't cover the care, which typically it does not, then they need to rely on Medicaid, and they'd be dual eligible, meaning Medicare and Medicaid. So you may see reductions to be determined in what services you're receiving at home, because states need to balance their budget. It's fascinating because the federal government doesn't need to balance a budget. That's why they can run deficits from year to year, billions in deficits from year to year. But state governments need to balance their budget on an annual basis. So if we're going to see cuts, it's going to be in the home and community-based benefits that are so valuable to those living at home with a disability. What those cuts are going to be, I don't have an answer. It's to be determined. So, and each state will have to determine for itself what type of programs will be affected. But there will be cuts, but it's to be determined how that will occur. So what does this mean for you and your loved ones? Well, it's going to make Medicaid coverage easier just through procedural issues. If you experience applying Medicaid, it's a pain in the you-know-what today. You need 5 years worth of Medicaid, 5 years worth of bank statements. You need all this documentation. It's not easy. It's document and it's document intensive. And the new rules and regulations and law is only going to increase the complexity to apply. It's important it will also, you need proactive planning. And it's going to create additional traps for the unaware for individuals, make access to long-term care supports arguably more difficult and to access, more onerous and complex as well. So what do? Well, I mean, get organized. Make sure your personal, financial, and legal documents are in place. And it's not just, of course, talking about government benefits. Make sure you have your last will and testaments updated. Make sure you have durable financial and healthcare powers of attorney in place. Make sure that your assets are organized in such a way where your beneficiary designations are updated, your life insurance beneficiaries are updated, any retirement accounts are updated to avoid any crisis down the road. I'm not going to talk about the 6,000 exemption because Christa already mentioned that. One thing, just a couple things on taxes I will mention that may affect you. This is all individuals, not those living with ALS. But one of the issues that there are tax changes so one of the changes that may affect you based upon your state as well as your annual income is the SALT deduction rises to $40,000. The SALT stands for state and federal income taxes. So including real estate taxes. So up until year 2025, for the past several years, the cap has been on $10,000 that you can deduct for real estate taxes and state income taxes. States that have high real estate taxes, like New York, like New Jersey, like California, as well as states that have federal state income taxes, like New Jersey, like New York, no income tax in Florida so that's why people move to Florida. It's one reason. You can only deduct $10,000 combined of real estate taxes and state income tax. That's going to rise for year 20. This is a good thing for those who can benefit. That will rise to $40,000 for year 2025, and then it will increase slightly through 2029. But then it will return to $10,000 in 2030 under current law. However, it's not for everyone. The deduction phases down for those with adjusted gross income over $500,000, but it's never going to be lower than $10,000. So for high income owners, it's still $10,000. But for many individuals, they can take advantage of the higher SALT deductions, which is a good thing. I mean, from that perspective. Also, in 2026, and again, whether you think this is good or not, this is the law, the federal and the state gift tax exemption permanently increases to $15 million per person. And if you're married, and if you're lucky enough to have an estate of up to $30 million. For married couples can exempt $30 million of their combined estate. So that's permanent, 15 million for a person and 30 million for married couples, and it will be indexed for inflation. Also, the standard deduction for year 2025 has increased to $15,700 for single files and $31,500 for joint filers. And then it's indexed for inflation. Now, so that has gone up significantly. So you would have to, you and your tax professional would need to decide whether you should itemize your deductions or just take the standard deductions, whatever works for you. For those who are receiving tips, I know there was, the Trump administration touted, well, no tax on your tips. So there's a new deduction on tips up to 25,000 cap on on tips, and a new deduction on overtime pay up to $12,000 cap. However, just like the $6,000 exemption, that's only in place for tax years 2025 through 2028. Then it goes away. So it's not permanent. It's only for tax years 2025 through 2028, and that will be adjusted for inflation as well. So with that, that's what I have. And I'm going to stop sharing. Should stop sharing. All right, there we go. And I don't know if there's anything in the chat, but we'll open it up for anyone who has first Q&A, any questions, comments on what was discussed.
We'll give it a minute, see if anybody has anything in the chat. Thank you, Christa, Jerry, and Chris.
Swipe left.
Well, again, I'll ask a question then. And so, Chris, do you have any concerns about what we just talked about with potential changes, and any concerns regarding that, or that you have regarding a reduction in benefits moving forward?
I do, right? And a lot of this is new to me. I currently am, taking the SSDI and Medicare, and but I'm also under, the age where I can deduct more. All right, I'm in my late 50s, so I'm concerned that I wasn't aware that that Social Security was, that fund was going to expire by 2032, and God willing, I'll still be here by then. If that results in a reduction of that income, that's going to be really tough for us. And I'm going to be in, physically, because of this disease, I'm going to need a lot more care and attention than I do now. So the combination of losing benefits and requiring more care could really be devastating.
Yeah. Thank you, Chris. And it looks like Eileen has a question.
Good afternoon. My name's Eileen. I'm a senior care liaison at Compassionate Care ALS. So we do a lot of advocating and working with our ALS folks who are in the community living. And you were mentioning the home and community-based waivers. Now, Massachusetts is pretty generous when it comes to these things, but it's starting to change. And then, of course, we have the dual eligibles, so the folks that are both on Medicaid and Medicare. But what we're seeing is these companies that are being contracted to supposedly take care of these folks that have complex medical conditions are already starting to cut their hours. So, for example, I have a gentleman living in the community. He gets quite a few hours of nursing each week. He's trached and vented, living at home on a mechanical ventilator. He has a feeding tube, and his medications are administered through that, and he uses a Toby. So he has a significant amount of nursing hours to keep him safe and healthy, and they've been doing a great job doing this. In mid-July, they decided to cut out a nurse. He had 2 nurses for 20 hours a day with some overlap. And then he has some personal care that is coming from the Medicaid, they call it Mass Health, Common Health, where he is the employer and he hires his employees, these PCAs, personal care assistants. So they don't come from an agency. So these PCAs were trained specifically how to deal with the respiratory and the feeding tube and those types of things. But the agency is Commonwealth Care Alliance, where he's a member, a SCO member, Senior Care Options, he's over 65, are saying that they can decrease a nurse and add a home health aide. So there's a difference between home health aides and PCAs in that home health aides work under agencies, and they also have limitations. For example, they cannot do any feedings, they cannot do any medication administration, they cannot do any trach care. So the Commonwealth Care Alliance is saying that the home health aide can follow under the direction of the one nurse that would be there to continue to take care of him. But it's not the case, and he's been on this program. Yes, it's very generous and it sounds very generous, but he's on this program. There are a handful of ALS folks in Massachusetts on this program living in the community, and so they just keep driving through and not paying his nurses. So we've allied ourselves with 2 different agencies, Disability Law Center and Health Law Advocates. And so they're trying to help Michael, advocate for the hours that he needs. And we're spelling out all of the details, what his day looks like with the 2 nurses. I mean, he needs the cough assist every 10 minutes or so. If he goes to the hospital, he has to go into the ICU because he needs one-on-one care. And so, but he's lucky enough to be living in the community, has quality of life, and he hasn't been hospitalized thanks to this team of caregivers. And so I think it's only just begun, even though, Jerry, you mentioned that it should be taking effect in the future. But I think that, they're forward thinking, saying, this is, and also this particular SCO was just recently taken over by a different group. They almost went under. And so, they're looking to cut corners, and this is just the beginning.
Eileen, I appreciate your thoughts. And thank you for your advocacy on behalf of the individuals you serve. Just a couple comments. You're right. Services in a home and community-based setting under Medicaid and other services, and the services are very state-specific, in many cases very localized. So what happens in what services in Massachusetts is different than what's in Pennsylvania. It's different than what's in Ohio. So it's certainly state dependent. And to a certain extent, you're right, because states are always looking to it's a budgetary issue, and there have certainly been cost savings over the years, for example, which is not a good thing. For example, I know in Pennsylvania, New Jersey now, I think as well as most states, most Medicaid recipients are in managed care, in MCOs, managed care organizations. So the states contract out with private companies to manage their Medicaid plans. And that's not necessarily a good thing for the individuals living with disabilities, because in many cases, they try to minimize benefits and cut in individuals for cost saving purposes. So I agree with you. You've been seeing the past several years, and of course, I would argue it's only going to be exacerbated. So one thing I'd like to point out, we only have a couple minutes left, and this is that we haven't touched upon, and this has nothing to do with the one big beautiful bill, and is that research is at issue as well for those with ALS as well as those with Alzheimer's disease as well. And that's another concern that my clients are coming to me with, and I'm hearing through those with the ALS advocates or Alzheimer's advocates and those who have Lewy body dementia and Parkinson's disease, etc., is what's the future research? And you know, the research at these institutions that have been cut. So what is going to happen with that? So that's certainly an issue what's the future of research when finding a cure for ALS as well as many other diseases that individuals and disorders that people are living with. No easy answer for that, but that's something I think that needs to be addressed as well moving forward. So just throwing it out there. I don't have an answer to it, but many of my clients are coming to me with those questions.
Thank you, everyone. Jerry, Christa, and Chris.
Thank
We
you.
really appreciate it. This was the first episode of our financial health series. A couple comments in the chat, great information. Thanks so much to both of you. So let me reiterate that. We appreciate your time and sharing your expertise. And hopefully this was very helpful to people with ALS and those who love and care for them. Thanks, everyone.
And thank you so much for your time. Thank you for the invitation. And we'll be happy to share the slides as well, Jeff. So
Yes, definitely. Thank you so much.
Thank you,
Great.
Jerry and Christa. Thank you very much.
Thank you. Take care.